Hello, everyone. My name is Josh Borkosky. I'm a paramedic and currently a clinical year PA student. I'm going to be presenting research that was conducted while I was working as an EMS educator at the University of Cincinnati's Division of EMS and done in conjunction with the University of Cincinnati's Institute for Policy Research. The title of our project is Paramedic Attitudes Toward Obtaining Informed Consent in a Pre-Hospital Research Trial. It's first critical that I thank my co-authors, Dr. Kimberly Downing and Dr. Jason McMullen, whose expertise and mentorship was instrumental in seeing this project to its conclusion. It's also significant to note that this project was funded by the EMF/NAEMSP Advancing Pre-Hospital Care Through Research and Innovation Grant. So what drove us to this topic is the fact that most pre-hospital research trials to date either are considered not more than minimal risk or are fall under exception from informed consent criteria, which in either case, paramedics that are involved in enrolling patients in such trials do not have to go through the standard informed consent process. However, if we're going to study topics that are considered more than minimal risk and do not qualify for exception from informed consent, paramedics are going to have to become comfortable and familiar with the standard informed consent process and walking patients through that in order to produce enrollments. So our objective was to gain insight into attitudes of paramedics on the responsibility of obtaining informed consent in the context of an ongoing prospective pre-hospital randomized controlled trial. We used a mixed methods approach in which we began with a survey validated with beta testing and iterative development. We then formulated an interview guide informed by open-ended and Likert scale survey results, and then conducted one-on-one interviews utilizing that interview guide. This study was conducted at a single EMS agency that's an urban fire-based agency. They have 250 paramedics, all of which were trained on human subjects protection and trained on the clinical study protocol. The survey was offered, the initial survey was offered during a continuing education cycle in which paramedics have the option to attend in person at the time. The timing of the survey was offered at the point of the randomized controlled trial in which about 50% of the patients had been enrolled. And then the one-on-one interviews were conducted during a COVID-related pause in the clinical trial in which, at a time at which about 75% of the patients had been enrolled. There were 96 attendees at the continuing education cycle. All 96 answered the survey. Interestingly, not all respondents currently have patient care responsibility. Some were in supervisory or administrative positions in which they did not ride the ambulance or have any patient care contact, so they were not actively enrolling patients. However, most had that responsibility, and the average respondent worked about a little more than one 24-hour shift on the ambulance per month. 20%, interestingly, had prior experience as a research subject at the time they answered the survey. Just quickly jumping over to the demographics, this was a very experienced group that responded to the survey. The average age was 45. They averaged 20 total years of experience in EMS and 13 years as a paramedic. We had a good mix of roles on the department, many officers, some chief officers, captains and lieutenants, and many at the firefighter level as well. The limitations of the study is we were not able to obtain a very heterogeneous sample in terms of gender or race, as most of the survey respondents were Caucasian males. Some of the results that we found particularly interesting under the importance of research was probably the most interesting to us, in that most of the respondents identified that medical research is important to improve healthcare. However, many disagreed that research in the pre-hospital setting is more valuable than hospital-based research. So we felt there was opportunity for education there to highlight the importance of research that's going to guide clinical practice is best done in the setting that clinical practice is performed. So we also found that the trial operations results particularly interesting, in that most of the respondents felt comfortable in applying the inclusion and exclusion criteria for the trial. And no one expressed any concern for getting in trouble if anything happened or went wrong with an enrollment. And that's attributable to the time investment by the principal investigator and the research team the time investment up front in conducting the training for all 250 members, and then the time investment ongoing throughout the trial and the availability of the principal investigator were critical to those findings, as we'll see below. The consent process, there were some barriers identified there. A significant number felt that the consent, starting the conversation for the consent process was difficult. Many identified the necessity to obtain a signed consent signature on a paper consent form as a barrier as well. And although a significant number of respondents identified some trial fatigue about midway through the enrollments, most of the respondents still felt like they were supported and still planned on attempting to enroll patients throughout the conclusion of the trial. So we felt good about the results from that standpoint. In the one-on-one interviews, we identified some key facilitators to research and also some key barriers to conducting the research. The key facilitators were the initial and ongoing trainings and the principal investigator availability that I alluded to earlier. Also, a key facilitator to research that was identified was the study kit packaging and labeling, which clearly identified inclusion and exclusion criteria and also identified a stepwise process for obtaining informed consent and enrolling patients in the trial that the paramedic could follow as they had a patient qualified and agreed to consent. Barriers to the research included obtaining signature on paper, the time required to get consent, and the fact that this was conducted in the setting of acute trauma. Many of the respondents felt that there was some difficulty with that. So based on these results, we concluded that paramedics participating in an ongoing clinical trial are generally supportive of pre-hospital research. The time and logistics required to obtain informed consent documented by ink signature are barriers to enrollment. Training, including role play and active principal investigator involvement, may be helpful in these areas. So thank you for your time and thank you for your interest in our research.